body and soul on 938 Live. Thank you for joining me once again. I'm Daniel Martin. Hi everybody, it's your daily health check. And today, you and I, we're going to raise our awareness of lupus, our understanding of what lupus is. Now, we're going to speak to a young lady who suffers from SLE, who's had it throughout her adolescent years and is now in her 20s. Serene Mai is joining us to share her personal experience with lupus on the program. Okay, Serene, let me talk to you about your experience. How did you first discover that you had lupus?
Okay, it was first diagnosed in 1994. It started off with a cyst on my neck, and I had an operation to remove the cyst, and after the operation I think I developed an infection, like what Dr. Leong said, that it could be a trigger for my lupus. So the doctor ran some tests, and then I was diagnosed with lupus.
Well, so this was when you were in your teens still?
That was when I was 9.
Okay, that was you were 9. My goodness, it's such a young age. You probably had no idea what lupus was.
Yes, I didn't have any idea what was happening, except that I was sick and that I needed to take medication and go for regular checkups.
Okay, but prior to that, you'd felt perfectly fine. Before 9 years old, you'd had no symptoms or no manifestations?
Yes, I didn't have any symptoms or manifestations before that.
Okay, so what started happening for you after the diagnosis? Like you said, more checkups, more visits to the doctor. I mean, did you recover from the complication of the procedure, first of all?
After I was diagnosed with lupus, I started to have rashes, and I just followed my mother for regular checkups, and I was treated for my lupus.
Do you know what kind of lupus it was at that time?
I think that time it was cutaneous lupus, and then along the way, throughout the years, I suffered from anemia, which I think the lupus attacked my red blood cells, and then there was a period of time where the lupus attacked my kidneys, and I had to go under chemotherapy treatment.
I see.
To put the lupus under control.
That's so challenging for a young person like you, and yet you're so comfortable talking about it as well. I'm very impressed by that. Serene, tell me, how did, during your teenage years, first, we all go through those teenage years where you're angsty and you think the world is against you and you think you know everything and things are going wrong. And on top of that, growing and becoming a teenager, you're dealing with a disease. How did you educate yourself to learn more about lupus?
I read up a lot on the internet, and then there's also a booklet given by the Lupus Association Singapore which explains what lupus actually is. So I learned that lupus is an autoimmune condition, and that the normal immune system actually fights against bacteria and viruses, but for lupus patients, the immune system fights against our own bodies. Yeah.
So the more you learned about it, did it make you feel more confident in dealing with it?
I slowly came to terms with the fact that I had lupus. But of course, with lupus, there were also a lot of emotional turmoil to deal with, especially the medication side effects, which actually causes weight gain. And when my kidneys were affected, I had to undergo chemotherapy treatment, and that made me lose a lot of hair.
Yeah.
And so mainly it's and also having to come to terms with dealing with a chronic disease that they say it's incurable.
Yep.
So it was a lot to deal with at such a young age.
Absolutely, and I want to talk to Prof. Leong about that when we return. Actually, this idea of the emotional toll it can take on patients as well, the power of support groups and information and advice from people who've had it before. All of these can be vital aspects for someone who's dealing with lupus, especially at such a young age. Serene Mai is my guest. She's a patient of lupus who's had it, as you've heard, since she was 9. She's in her 20s now. Associate Professor Leong Keng Hong also joins us. We'll find out more in just a moment. Welcome back to Body and Soul on 938 Live. Raising our awareness of lupus is what we're discussing on today's edition. I'm talking to consultant rheumatologist, Associate Professor Leong Keng Hong, as well as a young patient of lupus, Serene Mai. Serene, let me ask you, as a young person going for all these treatments, dealing with the loss of your hair at such a young age, how did you deal with that?
It was a very difficult period for me, but I think I was strong enough to just slowly accept that this is something that I have, something that I cannot control, and so that's how I deal with it.
Did you feel unhealthy, as in, I'm an unhealthy person in some way?
I definitely knew feel that I was different from all my peers and that I cannot enjoy certain activities as much as they do. But I wouldn't let that take me down, and sometimes I participate in some of the activities with them. But I'll try to take good care of myself, my health, and not overexert myself physically or mentally.
Okay. So you could still, take part in what you wanted to, but you became more aware of what you could and couldn't do.
Yes.
Were there a lot of times when you had to be out of school for treatments and things like that?
Yes. During my regular follow-ups and checkups, sometimes I'm given. I wouldn't know that I had a lupus flare because some of these flares do not manifest itself outwardly as symptoms. So the only way to detect that I had a flare was through my blood tests or urine tests, which actually indicate that, say, my kidneys are affected, and sometimes I had to be hospitalized at a short notice, and therefore it really disrupts school a lot, and sometimes I'm warded for a few days in a row or even up to a few weeks. And so I had to be off school, I had to miss lessons.
Off and on all the time?
Yes, and my parents had to collect homework for me. Yeah, and some of my friends actually helped me a lot.
Did you have that horrible scenario where you had to do exams in the hospital?
Oh, no.
that never happened, thankfully.
Yeah, thankfully.
Okay, well, this idea, that can be, if it's so challenging, and I want to know more about how you dealt with it, because, again, I think your experience is going to be so enriching to our listeners who might be dealing with the same issue. You seem to be so full of determination that you didn't want it to let it beat you, and we're going to get some more advice from Prof. Leong about what you can do if you do find yourself in the same situation. What's the most important course of treatment and dealing with the changes that might have to happen to your lifestyle as well. More when Body and Soul continues. Lupus Awareness on today's edition. Welcome back to Body and Soul on 938 Live. We're talking about lupus in today's edition, and it is something that's been known to affect mainly women. It's an autoimmune disease. We've heard about how the manifestations can be so varied because it's actually your own immune system fighting back and attacking different parts of your body. Not often can you predict how it's going to attack your body. There can be several manifestations. As we've heard, it is a lifelong condition. There is no cure, but there are ways to manage and deal with it throughout your life. And most importantly, it's understanding the important steps that you can take as you live with lupus successfully. Associate Professor Leong Keng Hong joins us, a consultant rheumatologist at Arthritis and Medical Clinic based at Gleneagles. He's also adjunct associate professor at the Yonglin School of Medicine at NUS. We're also hearing from Serene Mai, who's in her 20s. She suffered from lupus through her adolescent years. Her diagnosis came when she was 9 years old, and she's in her 20s now, living a wonderful life in the sense that she's dealt with it so successfully and is also learning to help other people deal with their lupus as well. Let's talk to Serene a little bit about that. Now that you're in your 20s in your working world, we've talked about the ideas of flares. You've learned a lot about management and medications. What have you done in your 20s in your working life to live successfully with this?
I have been living quite a normal lifestyle as compared to my peers. But thankfully for all the regular checkups and follow-ups and all the close monitoring, my doctors were able to identify whenever there's a slight problem with my body, and then prompt treatment will be administered. And so...
In what form usually? Is it usually medication?
Yes, usually medication, and the dosage will be increased slightly just to manage to suppress the immune system.
Okay, how often do you see your doctors, if I may ask? Is it very often?
If I am in remission, probably about 3 to 4 months, once every 3 to 4 months.
Okay, it's not so
and
bad.
if there is a flare, then it can be up to once a month or even once every 2 to 3 weeks, depending on the severity of the flare.
So what have you done in your working life in terms of changes? I mean, have you become very, a lot of people when they deal with disease tend to become more healthy somehow, with the diet and the lifestyle, the exercise and all that kind of thing.
Yeah, I'm definitely more aware of my health status, and I try to exercise regularly and to eat more healthily and to manage my health better, not to overexert myself physically or mentally too much. Yeah.
Are those important steps, Prof. Leong?
Well, I think if one is less stressed and able to cope mentally, generally everything gets better. I mean, we have seen patients who, when they're under a lot of stress, let's say they are busy at work or taking exams, and it does appear that the illness seems to flare, but it's very individual though. I mean, there are some patients who are very stressed all the time and they're still okay.
Okay.
So I guess for individual patients, the plan may be a bit different. We have recommended in the past for students to maybe take a year off till the disease is stable, things like that. It depends on the patient.
Okay, Serene, again, congratulations. You're married, planning for a family. How long ago was the wedding?
I was married last year.
Last year? So still a newlywed. Still the honeymoon period sort of kind of thing. And you were telling me something so interesting. I hope you don't mind that we share it a little bit. You said that you hadn't made plans for marriage. It wasn't really something that you were thinking about because you were dealing with this disease. But now that you've learned in your 20s to deal with it, family options, planning options, everything is on track.
Yeah, I used to wonder whether I will actually meet a right person who actually accepts me for my condition, because this condition is unpredictable. Anything can happen to me, and I need to go for regular checkups. I need to be on constant medication. So marriage was definitely something that I was worried about when I was young. And but as the years go by, as I received proper treatment, proper advice, and I go for constant follow-ups, and whenever there's any problems, prompt action is taken to treat my condition, I find that my quality of life has been as good as or even better than some of my friends.
That's wonderful, and I know that you found quite a bit of purpose when it comes to working with the Lupus Association. I want to talk a little bit more about that, the importance of support networks, when we return on Body and Soul. Learning more about lupus and how you can successfully live with it with the right attention to your appointments, your checkups, your medications, your lifestyle, and you can lead, as you've heard Serene describe today, just as happy and successful a life as any of your peers, really. Prof. Leong, I know that the role of the Lupus Association is very important to you, and this idea of the support network is very important to you. Why is this so useful and powerful for patients with lupus?
Well, as we've all heard this morning, lupus is a rather complicated disease. And I think the more that the patient understands about it and cooperates with the treatment and has her own social support network, the better the outcomes will be. And I think Serene illustrates that very well today. And that's why we want to really reach out to patients with lupus, and they're welcome to Google our website and our Facebook, Lupus Association Singapore. Or they can contact us anytime and join in our events and activities.
That's fantastic. Serene, I know that you joined. You found a lot of purpose with the work that you do with the Lupus Association. You're volunteering with them, and do you get a lot of chances to speak with younger patients like who went through the same thing you went through?
Yes, I manage the Facebook page for Lupus Association Singapore, and I receive a lot of queries via the Facebook page. But I will usually direct them to a specialist to answer their questions, because every lupus condition is unique.
Indeed.
Yeah, and they require a specialist to provide the proper medical advice for them. And also at the same time, my personal Facebook page, I talk about lupus very openly as well. And I have friends who private message me to tell me that there is a certain friend or relative that they have who also have lupus, and they will ask me some questions about what it is and what kind of foods they can take or what kind of precautionary measures they can take.
Yeah.
But whenever that happens, I will just try to direct them to a specialist, to a rheumatologist, so that they can actually get proper advice.
Of course. But the opportunity is there to speak to someone who's done it before, so to speak. So, I mean, I've often heard people who are in your situation, who volunteer in this way, say that, yeah, on the one hand, you're helping someone, but on the other hand, it's helping you as well. Do you think it's helped you in your journey with lupus?
Yes, it definitely helps me a lot, and I find that there is more purpose in my life to be helping lupus patients. I find that I'm happier when I actually reach out to lupus patients, because I know that they can actually have they can seek proper help and advice for their condition and not feel like they are alone in their journey.
That's fantastic. Prof. Leong, a final word with you. We wouldn't be able to suspect that we have lupus until that trigger point, so to speak. What's your advice for dealing with it from that point, the very first point?
When do you know you have lupus, is it?
Yes.
Well, it's a bit difficult, but some of the common symptoms would be a rash that's worse in the sun, like a butterfly-shaped rash on the face. Yeah. Joint pains, but especially if there's swelling. Once the joint is swollen, there's something going on. If the ankles become swollen, that you're retaining water, or without knocking yourself, you get bruising. or you have fever that never settles, with no good reason. So these are some of the more common symptoms. But the thing is, if you're not sure, you should consult your family doctor, because nowadays our family doctors, they are able to pick up lupus fairly early, and we're seeing a lot more early referrals, which is a good thing.
It is a good sign indeed. Prof. Leong, thank you so much for your time. Serene, thank you. I'm very impressed. You're a young, empowered person. I'm very impressed and thankful that you shared your experience with our listeners. Thank you to you both and for helping us understand lupus on today's edition of Body and Soul on 938 Live.